Okay, so our group had the compound curcumin, and in total, our group is Champ, Eli, Isaiah, Jacob, myself, and Ro. So let's get into curcumin. So, what is curcumin? Curcumin is a bright yellow chemical compound that is produced by plants of the Curcuma longa species, and it's the principal ingredient of turmeric, which is a spice. And it's also found in mustard seed, another spice. And both of these things are used as herbal supplements. And curcumin is commonly found in East Asian dishes, curries, and these sorts of meals. It's also used as a food coloring because of the strong yellow presence that this compound has, especially once cooked. So curcumin consumption, as we mentioned, it is consumed as a supplement as well as a spice. And the primary difference is that turmeric, which is containing curcumin, is containing 2 to 9% curcumin, whereas a supplement that is curcumin extract is going to be upwards of 95% curcumin, so much higher concentration there. So, what are the proposed health benefits of curcumin? There's a lot of interest in curcumin for conditions like osteoarthritis and rheumatoid arthritis. It's proposed to help with inflammatory conditions, metabolic syndrome, pain, degenerative eye and kidney conditions. And so the question about curcumin really is, what is its therapeutic value as an anti-inflammatory supplement? So that is what our study looked at, which we'll get into shortly. And this was the study. We found a systematic review on the therapeutic effects of turmeric or curcumin extract on pain and function for individuals with knee OA. And this study ended up having 10 total studies included, which made it through the selection criteria. Total of 1,287 subjects included, a variety of durations from 4 weeks to 8 months, and a variety of dosages from 93 milligrams to 2 grams per day. And initially, there was quite a few studies identified in the database, 5,273. And then, as we mentioned, after the exclusion criteria, there was a total of 10 that were found. And this systematic review did use the Cochrane collaboration tool to assess the risk of bias in the randomized trials. And so, risk of bias was part of the selection criteria. Okay, so let's get into the results from the systematic review. So we'll look first, we'll just kind of walk through each of these major studies and what they showed. So we'll start with the Panda 2014 paper. And this was comparing Curine supplement to a placebo from 7 days out up to 60 days out. And in that initial 7 day follow-up, they did report a large magnitude effect with the visual analog scale. But aside from that, there was a small magnitude effect in the WOMAC, pain, stiffness, and the PF. And as we get to 15 days, 30 days, 60 days out, those numbers just continue to rise. And so by 60 days out, we do see each of the parameters. There is a large effect size comparing Curine to the placebo, which is a strong bit of evidence for the benefit of this compound. And then the Madu 2013 paper compared NR-INFO2 to a placebo. So again, we're comparing placebo to the intervention, and 21 days out and 42 days out, we do see a large effect size in both of those groups. And for the Shep 2019 paper, down at the bottom, here we have the first paper that is comparing curcumin or turmeric to an actual NSAID, so diclofenac. And 14 days out, we do see a small magnitude of effect size for the VAS, the KOOS, pain, quality of life scores, but we do see a moderate magnitude effect in function in daily living and function in sport and recreation, which is interesting. And that same study, 28 days out, Again, we see null or small results for the effect size on most parameters, except for function in sport and recreation did seem to be a little bit higher at a moderate effect size. And then the Panahi 2010 paper compared curcuminoids to a placebo 6 weeks out. And from the WOMAC global score to the pain to the stiffness, we do see a large magnitude effect size there. So again, we're seeing that compared to a placebo, it does seem to be making a significant impact. Um, and then as we look at the Henrotin 2019 paper, compared a high dose and a low dose BCL to a placebo. And this paper found 1 month out or 3 months out, there was a small effect size reported. And then Cooped Nerat Cycle 2009 and 2014 papers comparing C. domestica to ibuprofen, 6 weeks and 4 weeks out, respectively. Um, Again, we see comparing to an actual anti-inflammatory um, that results are small to null to moderate. We do see that pain while ascending stairs, there was a moderate magnitude effect size comparing the treatment to the control. But aside from that, not much of an effect compared to the ibuprofen that was used. And then the last paper that we have in this systematic review was the Srivastava 2016 paper comparing CL extract to a placebo at 60 days. And at that 60-day period, we do see that again, as the trend has been, we have seen that the treatment compared to a placebo has a large effect size. So the VAS, the WOMAC, pain, stiffness, the PF, all of these showing a large effect size. So, all in all, what they state as their conclusion is that the results of this systematic review suggest that turmeric therapy may be a beneficial addition to current treatment regimens for patients with knee osteoarthritis. Although limitations exist within the 10 randomized control trials reviewed, this small set of studies show a reduction in pain and improvement in function similar to that of NSAIDs, but with a reduced incidence of adverse events. Turmeric appears to be a safe adjunct to NSAID therapy, allowing for additional analgesic benefit as well as reducing dosage requirements for NSAIDs. So that is a mouthful, but basically what they're saying is that it appears to be safe, it appears to be an alternative to NSAIDs, and it appears to have a benefit, but the magnitude of that still needs to be investigated to see if it can be used in addition to or in replacement of. That still needs to be determined in further research. So again, just to summarize the key takeaways, it appears to be effective for improving pain and function in adults with knee osteoarthritis. It appears to have a better safety profile compared to NSAIDs, and questions do still exist regarding proper dosage levels. So, um, further areas of research could be more into the different supplements that were used, the varying amounts of curcumin in those supplements compared to natural ingredients, and what the effects were there. So, all in all, looks pretty good for curcumin. And here are our references.